Hartmann is going to present detoxification of mycotoxins, which is very hard to detox. But just want to make sure that one of the big thing that I think Dr. Stefan brought to the table is iodine. And I started reading about it more and more, and I think I can give iodine is going to be the top supplement agent that you can use against cancer, because the chance of having cancer, as we know, is a flip of the coin throughout your lifespan. And we're looking for things that helps to reduce it from 50% at least to 30% to 20%. And we know the top cancer are top cancers are breast cancer, prostate cancer, colon cancer, lung cancer. Those are the top cancers. Melanoma, skin cancers. But those are the four. And we find out those four cancers, really, it's estrogen dominance plays a big role in a factor in causing them, or factor of contributing in those cancers. And therefore, iodine is the best supplement that you can take to lower that chance of cancer. I think iodine is even better than amloxanox, exceed curcumin, polyphenols. I think it's a top, because if you see it, it does have it regulates the estrogens, and it moves estrogen to estrioles, not estrioles, which is the more safest. Does have anti-proliferative, anti-inflammatory versus the estrogens, and also it helps to get rid from the xenoestrogens. So the iodine works as a detox for xenoestrogens. And estrogen dominancy syndrome lead to deficiency of iodine because it didn't have the absorption of iodine. So I think because of the environment that we live, of exposing to those halogens, whether it's fluoride, chlorine, brome, all this toxins that antagonize iodine take its place, I think iodine 10 milligram a day is supposed to be mandatory for everybody, especially above 50, to combat the rise of cancer. So 10 milligram daily of iodine, I do recommend it, because the chance of having prostate cancer for male, it increased per year from at the age of 50, 60, 70, 80, 90, it's 90%. You will have cancer cells inside the prostate. And therefore, the only way we can slow the process of cancer, prostate, and breast cancer, and especially cancer prostate, and even cancer hypertrophy and prostate hypertrophy, is using iodine. So therefore, I would recommend all the doctors here to start recommending iodine for all your patients if you want to give them that kind of peace of mind and lower the risk of having prostate cancer and prostate hypertrophy, and also breast cancer and many other cancers. And I think we need to have a topic. I'm going to have a lecture, whether Stefan is going to do it or I do it, regarding iodine as an antioxidant, anti-cancer, anti-proliferative, and apoptotic agent. It's anti-cancer quality. It's just it tops every supplement out there, and it's the safest thing that you can do. Yeah. The second thing we want to do is that we want to make sure the sponsors of this event and all weekly webinars, Dr. Mike Emanuel, the pharmacist, who are adapting our all protocols. And actually, we add iodine in our supplement as a weight loss ingredient, because it does help in weight loss, because it counteracts estrogen dominancy. So that's one way of mechanism, but there's many other mechanisms of activation of the mitochondria. It works like methylene blue. It donates electrons and neutralizes free radicals, and so it works like a redox buffer as well. Iodine, same like methylene blue. So I'd like to have Mike Emanuel to introduce himself. He's adapting all the protocols. He's adapting the concept of balancing bioidentical sex hormone, which is making sure you're adding progesterone, and the ratio of progesterone to estradiol has to be above 100, and the ratio between testosterone and estradiol for men has to be above 20. all this ratio and all and importance of adding progesterone, so that the progesterone, I'm talking about post 50, which is the post menopause, and guys above 50, their progesterone has to be at least 1 nanogram. That's the target to counteract the effect of estrogen dominancy. And adding iodine is the best thing you can do. All of this, in addition to the weight loss diets that we developed from amnoxanox, naltrexone, and we find out all those ingredients, including acarbose, are coming from the nature. Mike Emanuel has the diet capsule. And then Dr. Hotan, I think he's here. I don't know if he's here or not, but he has a very nice probiotics. The probiotics that helps in weight loss, because it has the bifidobacterium, which helps in releasing all those postbiotics, which is butyric acid that helps to decrease inflammation and inhibit the Th17 and helps to reduce the fat inflammation of the gut, especially the visceral fat. And so having in the morning probiotics and then taking diet capsules with heavy meals, and at the night taking detox. I think something we can recommend it for everybody. Detox of activated charcoal, zeolite, chlorella. You can add EDTA, and you can add N-acetylcarnosine. But also in the diet capsule, there is iodine there, but you can take it separately if you like as well. And then making sure that all your patients above 50, that they're balanced their sex hormones, because without the balancing sex hormones, it's going to be difficult to reduce weight. So doing all of this, then you have a program of health optimization and weight loss that's effective and efficient. And so I do recommend everybody. I think Mike Emanuel is here. Are you there, Dr. Mike? If you want to go ahead and introduce yourself to the crowd. Dr. Mike.
Hi, everybody. Hi, everybody. I'm going to include my email address if you're interested. You send us your prescriptions, and we're going to send it to your patients or your office.
Yeah, so I recommend everybody here, our doctors here, if you want to keep this weekly webinars going, then I would recommend everybody here out of, for their goodwill, to send your scripts to Dr. Mike Emanuel. He's learning from us. You go ahead, Dr. Mike. You want to say something?
Oh, I appreciate it. If you can send us your prescriptions, we can ship to your patient within 24 hours, and they can receive it.
Yeah, and Dr. Hotan is not here, right, as usual. But Dr. Mike Emanuel carries Dr. Hotan's probiotics. So in case you can even order the morning probiotics that we talked about, and then the diet capsule with heavy meals, and then at night detox, and then all the 6 hormones also he carries them as well. And iodine, if you can also provide that to your clients, that would be nice too. So, and then we have Audrey. She's also sponsoring the event. Audrey, she's doing exosomes. We recommend everybody to order their exosomes from Audrey. Are you there, Audrey? You want to go ahead and introduce yourself? Audrey? Are you there, Audrey? No? Okay. Audrey is not there? Audrey 1, Audrey 2. Okay, she is busy. Okay, so maybe she will have... I'm here. Okay, you want to have a mic talk a little bit? I can't. Okay, at the moment. I'm in mute. No, you can unmute yourself. Just go ahead and mute yourself. Let me see. Make a co-host here. Just unmute yourself. And if you can't, I cannot unmute you because ask to unmute. Okay. You want to
Dr. Halasa?
Yeah. Yeah.
Dr. Klatz here. How are you?
Hey, how are you?
I'm great. I really want to thank you. This is great information, and it's a good gathering, and there's a lot of useful stuff. I wouldn't be spending my time here every week if it wasn't of great value. But thank you in spite of all that, because you're doing a service to your fellows and you're helping to advance the science. Could you repeat your PM protocol for detox? Because I think that's really critically important. I think that before you go to sleep at night, it's interesting. I just read about a study, an archaeological dig, and they dug up a bunch of pharaohs, and they did a bunch of studies on the pharaohs, and they found that the pharaohs who lived long time in those days, ancient, these guys were living to 60, 70, 80, some of them as old as 90, fairly well documented. Now, there's stories, of course, living beyond that, but well documented. Good science to support life expectancies, into the 60s, 70s, 80s, maybe 90. But what they found is that the ones who were long-lived, they died with tremendous amounts of disease. They didn't age well. They aged and they lived, but they were racked. Their bodies were racked with disease, and I think that that speaks very clearly to what happens when age-related immune senescence occurs. Is that we lose the ability to protect ourselves from various and sundry different infections, and I think a PM protocol for everyone to help detox and augment the immune system is a brilliant idea. And maybe you could just repeat what you said a few minutes ago.
Yeah, what I'm trying to say is that we need to encourage doctors to start doing what we call the health optimization. And because of the risk of having cancer, it's almost flip of the coin, 50%. And so when we find out estrogen dominant syndrome is one of the reasons why we have all these cancers, breast cancer, ovarian cancer, prostate cancer, estrogen or estrone is part of it. And estrogen dominancy is also due to extra fat, because the fat will turn those testosterone and estradiol to estrogens, and those estrogens is carcinogenic. And so we need to balance that with progesterone and giving iodine. But we also need to have a program for weight loss. And that's where we develop a diet capsule, which also, those diet capsules contain iodine, amloxanox, naltrexone, metformin, which also they are senolytics as well. And they activate the AMPK and they inhibit the mTOR. So, and they activate the beta oxidation and they end up helping the burning the fat without any side effects of the harsh ones that we have. And all those ingredients are coming from the nature. Acarbose is coming from the nature. Metformin is from the nature, if you go to their origins. And then in the morning, we take probiotics, which is Pidiform, Bactrim. And then at night, I think because when we sleep, the sleep is detox. Sleeping is detoxing. When we sleep, the max of our detoxification happen during the sleep, because when everything is being shut down, that's where your body start cleaning up the whole thing and replenish everything. And so during that night, it will be good before you sleep if you take activated charcoal, zeolite. Those are the ones that we know. EDTA, possibly you can add them. You can add N-acetyl carnosine, because it's very good to inhibit or counteract the glycations, right? As oxidation of glucose and all the sugar of our body, you can slow that process of the glycation by giving N-acetyl carnosine. And also chlorophyll, it's a very good detoxing as well.
Halasa, yeah,
Yes.
Dr. Halasa, can I just stop you for a minute? You said
Yeah.
at night you take charcoal, you take zeolite, and you take chlorella, etc. And then you take NAC, and then you take acetyl-carnitine. That don't go together, because it will bind it. And you think you are taking it, but it will bind to that. So you are giving those binders at night. You are suggesting that, and then at the same time you are suggesting nutrients. So I think one has to be very careful that in 2 hours of taking those binders, you cannot take nutrients.
Yeah, I'm talking about night, taking those binders at night. You got my point? And you want to separate them, you know, take them 2 hours in between, that's fine. But those are binders, you know, just at night, not with the nutrition in the morning. You got my point? I hope. Okay. So that's my recommendations, but everybody here can tweak it, change it in a way that makes sense. Other than that, if we have here Dr. Hotan or Audrey, if you want to come up with a mic, Audrey 1, Audrey 2. Okay, she's not there. Okay, so let's go ahead and have Dr. Stefan Hartmann to start his lecture. And the mic is yours, Dr. Stefan, and I think everybody knows you. And if not, if you can go ahead and introduce yourself, give yourself some brief there, and then you can go ahead and start with your lecture.
Yeah.
I'm here. Okay. Audrey, you want to come to the mic? Say something about your exosomes?
Maybe later.
It is not working. Okay.
Sleeping.
Go ahead, Stefan, and then when you start working and you're able to make it unmute,
yeah,
and then I'll talk to Dr. Joseph so he can buy you a new iPhone. Dr. Joseph, you need to buy an iPhone, good iPhone for Audrey. Here's the mic is yours. Go ahead, Stefan.
Okay, excellent. Thanks for having me, Dr. Halasa. Stefan Hartmann here, PA, owner of Iron Direct Primary Care. And today is going to be a kind of a personal story, my trials treating mold and mycotoxins and sick building syndrome, my struggles with this. I'm going to share my screen here. And we're going to talk about, the detox protocols, the nighttime protocols, as Dr. Ron Klatz was correctly describing, because you do want to take a lot of these antioxidants at night. I believe that's the best time to take these. So here's my lecture. And yeah, this is quite, it was a kind of expensive learning process. So you guys are going to learn from me, maybe save some money in the meantime through my errors. Okay. So this was myself back in 2021. I bought a house here, new house, very happy about that. I felt pretty healthy. I mean, I didn't really experience any problems. But I had just started Iron DPC here, and I was building out a custom panel for my patients. I was testing around what was useful to order, what was not useful to order. I really didn't take much supplementation other than magnesium. I think I had a bit of hypothyroidism at the time because I did deal with a bit of a constipation issue. Right off the bat here, my first panel, you can see some issues. Elevated white blood cell count of 6.3. We know that this is actually indicative of earlier mortality. If you look at some of the research that Dr. Tom Lewis has done, elevated white blood cell count is indicated of mortality. So that's something you want to keep below 5 ideally. Other things to abnormal here, T3 of 2.7. This is not good. My TSH was elevated at 3. Again, you want the TSH at 1. You want a T3 above 3, ideally at 4, to prevent cardiac mortality. So I had some problems going on here. Although I did not feel bad, I did not have a lot of problems with low thyroid function. Testosterone levels were good, 800 total, free of 16. I did have some spike. I never took the jab, never wore a mask, never got sick in the pandemic. I'm a pretty healthy guy, but I still got spiked anyway. You can see a level of 403 in the SARS-CoV-2 spike antibody dilution. But I don't think that's indicative of my elevated white blood cell count. Other labs that I had done as a baseline screening, right? Hemoglobin A1C, good. DHEA above 200, pretty good. IGF-1 of 140, which you can kind of expect. And a 30-year-old male, or at that time I was, 29. Vitamin A, 41, pretty good. Vitamin D without supplementation of 67.5, which is actually quite rare. When I measure the population at large, very few people can achieve a vitamin D level really above 50 without exogenous supplementation. I attribute this to a couple of reasons. One is I'm quite lean. When patients have a bit more fat mass on them, since vitamin D is a fat-soluble vitamin, they need more vitamin D to get a higher vitamin D25 hydroxy. D-dimer, normal. Back at the time, I was kind of building out a panel, see what was useful and what was not. Uric acid looked good. LDH, fine. GGT, 12. I use GGT sometimes as a proxy marker of glutathione necessity. When you see higher GGT values, you might want to run like amino acids and glutathione levels on people. SED rate looked good at 2. So remember that SED rate looked good. Overall, everything decent, right? CRP, kind of note that 1 because that's going to be abnormal later. So we had a baseline decent levels here. This is also my baseline initial values. You can see elevated LDL particle number, ApoB 104. Now, cardiologists might get up in arms about this, a little bit worried that my cholesterol was a bit high, LDL-C of 130. But I personally am not that worried about that. Yeah, I'm very lean. I eat a great healthy diet. I exercise a lot intensely. My triglycerides are at 53. So overall, I'm not too worried about this. And this was back before we knew about the lean mass hyperresponder phenotype. We're going to go in a little bit about that here, kind of describe what we might be seeing here. But essentially, increased LDL cholesterol on a low carbohydrate diet in adults with normal but not high body weight. This is new data coming out by Dr. Nicholas Norwitz. So basically, it's a population of individuals, kind of rare, we have to admit, in the American population, of super lean individuals who eat an animal-based diet. There may be keto or low carb. What you'll see in this picture is low triglycerides with an elevated cholesterol. So this is quite abnormal. Typically, when we see patients with elevated cholesterol, they also have elevated triglycerides and they have the obesity phenotype, right? The kind of that, what Dr. Halasa is describing, the estrogen dominance, the bigger bellies. This is not myself, and this is not the specific population called the lean mass hyperresponder. But in this particular study, kind of interesting, what they did is they put these patients with the high cholesterol and the low triglycerides on a low ketogenic diet. They changed that and they gave them Oreo cookies, 12 cookies a day. And this lowered their LDL cholesterol by 71% in just 16 days. While rosuvastatin, 20 milligrams a day, comparatively, lowered that same population by only about 32%. So Oreos were 2 times as potent as high-intensity statin therapy for LDL cholesterol lowering in these lean mass hyperresponder subjects. So for me personally, I'm not going to eat Oreo cookies, nor am I going to take rosuvastatin. But I will monitor my lipids, and we'll see later on there were some changes. So this is the viewpoint here. 12 Oreo cookies a day dropped this doctor's LDL by 300 points. Now, thankfully, my cholesterol is not that high. I do still eat carbohydrates, so that may buffer some of my LDL and cholesterol. I'm not strictly keto. Okay, we'll skip over this here. This is my May 2023 protocol. I started learning about iodine because I was trying to fix my thyroid naturally. 3 milligrams, started out with the Lugol's dropper, not much, because, that was back before I didn't know about higher dose iodine protocols. Selenium, 200 micrograms a day, basic creatine stack, vitamin D. I wanted to boost my vitamin D levels up. And I took some Glynac as well, and NAC and glycine. And this BioPro product to boost growth hormone. Although I don't think I was taking it for this test here. So you can see the iodine had increased my TSH up to 5.5. Now, that's normal. When you start a patient on iodine, their TSH will go up. And this is just because you're giving the body back that substrate to produce thyroid hormone. Thus, the TSH will go up. However, I wasn't seeing the intended and hoped effect, and my T3 actually went down lower. Well, I didn't start myself on thyroid medicine just yet. I was still going to give this a little college try. You can see my LDL particle count went up a little bit, but kind of pretty much the same triglyceride values. Still not too worried, right? If you just look at that in isolation. But I went a little bit deeper. I ordered CRP, HS, and oxidized LDL, and it was off the chart. And this was a change from before. Obviously, I didn't order an HSCRP before, but this was a bit concerning for me, seeing an oxidized LDL. And maybe it's not super important, an oxidized LDL alone, but when you see a C-reactive protein actually, this is a quantitative value of 21, kind of high, right? I was a little bit concerned about this. But in the following days, I got a diarrheal illness, and I was like, nothing, don't worry about it. We'll just repeat the labs again at a later time. Let's see, everything else kind of the same here. But I was a little bit concerned, so I got a mold inspector to my house because I had these white blood cell count elevations, elevated CRP. My green detectors, he found mold in my ducts. And this is what that looks like. I think that's a black mold, old home from the 70s. So I was kind of concerned about all my oxidized LDL. So I ordered the Genova Nutra Eval, which also confirms some pretty bad news: high oxidative stress, mitochondrial dysfunction, and toxic exposures, and methylation imbalance. When you see that, you're not too happy, right? I did have requirement for amino acids. I did have some mercury exposures as well. That's probably from the sardines that I eat, unfortunately. So I updated my protocol. I started adding glutathione. I started adding more vitamin C, alpha lipoic acid. I started doing Dr. Halasa protocol, methylene blue. I talked to Dr. Joseph about 5-amino-1-MQ. I did all these things. Didn't really notice too much change in my lab work or how I felt. When I didn't really have too much symptoms to begin with. I did add on Vasconox and Arterosil. These are cardioprotective nutrients because I kind of was worried about the oxidative stress going on in my arteries. Then I was like, well, I got to treat myself for mold. I got to really, take care of this. But what does Dr. Andrew Campbell recommend for getting rid of mold, detoxing mold? Well, you get rid of the mold. Okay, you got to remove the cause. You either got to get out of the building or you got to tear out all the moldy stuff, right? But he also recommends some level of treatment, right? His flagship protocol is the Sporanox. He also sometimes recommends voriconazole intranasally as well. However, after I looked at the molecular structure of this thing and I noticed the fluorine atom attached to it, I tossed this stuff right in the trash. I didn't want to breathe fluoride right up into my pineal gland, right? So we get rid of that immediately. No fluoride products for me. This is what my ducts look like here. You can see the mold growth on this AC unit. You can notice the dust. The dust is where the mold is contained. That's where you're going to get the problems. I had it all ripped out. It cost me about 10 grand. But it was out of the house. I wanted it out. Months later, I learned that the UV light that Green had installed was lost during the new AC install. So I had to spend another $1,000 on the ream to prevent mold. This ream is kind of like the higher end UV light filter to make sure there's no more mold growth in your unit, right? So that's kind of like the top of the line product. So itraconazole, yes, Dr. Andrew Campbell, big fan of this. So I ordered this stuff. I actually got it from Canada because I didn't want the generic itraconazole. I wanted brand name Sporanox, which is way too expensive in the US. So I ordered it from Canada from this place. You can screenshot that, info@americasaveonmeds.com. It's actually pretty affordable. I took 100 milligrams twice daily for a month based off the pretty convincing evidence of itraconazole for a variety of ailments, but particularly mold and mycotoxin ailments. And yes, it is known to also potentially be used to treat cancer. I updated my protocol further. Still, testosterone is very good. Didn't really suffer anything like that. The cod liver oil was not on at this time. This was something I picked up later. Still using the bioprotein and high dose vitamin D is pushing my free testosterone upwards of 31, which is quite high. You don't really see that in natural, non-testosterone users, which I'm not a testosterone user. But I think the bioprotein and high dose vitamin D was able to push my free testosterone into super physiologic level. I was also on Nepronol. You noticed that one there because I was still concerned about the cardiac risk I was suffering at the time from all these mold and mycotoxins. Didn't want to cause any damage in my arteries. So that's just another level of protection for myself. Finally, my white blood cell count went below 5. After many months of sitting around 6, sometimes 7, it went down below 5. So I was happy to see a 4.7, the white blood cell level. Maybe something was finally working here. Iodine serum high, of course. When you take iodine, it's going to be elevated. I don't worry about that too much. That was about 3 drops a day. My glutathione was a little bit low still. TSH still elevated at 5. T3 still low at 2.9. T4 improving somewhat up to 1.6, but not really where I wanted either. My labs were okay. I still want better. So my C-reactive protein cardiac actually was not much better. So I was still concerned at this time. So I was saying, well, it was not getting better. Maybe I have to use some more pharmaceuticals. Maybe I have to go on rosuvastatin to lower my CRP. I mean, doing all this stuff here, but I'm just going to repeat it one more time. So I maintained this protocol for several more months. I added prebiotics and probiotics, Megaspore. I added red yeast rice to try to improve my cardiac risk, turmeric daily, and I started doing 500 milligram niacin flush in combination with traditional barrel sauna therapy at about 190 degrees Fahrenheit in an attempt to detoxify the mercury I had found previously, right? That's actually an old protocol, niacin and sauna to detox mercury. It was used in Spanish miners back in the 1900s who had mercury toxicity. They would actually use alcohol, so they would drink beer before going into the sauna. The beer would act as a bit of a chelator of the mercury, but I preferred the niacin. I also increased my iodine from 3 milligrams to 12 milligrams. This was as I was learning more about higher dose iodine therapies and presenting that to this group here. This is an embarrassing photo, but this is really what I was dealing with. I had been dealing with this for approximately 2 years, and it was I don't know what it was. Your guess is as good as mine, but it was a dermatitis, and I think it was related to the mold and mycotoxin illness. And I had this for approximately 2 years, doing all sorts of stuff on it. I put topical, fungus cream. I put iodine on there. I was taking all this stuff, but it took a long time to heal this. And I think it was accumulation of all these things, getting rid of the mold in my house, taking all these supplements, doing this Sporanox, and finally this thing healed. And you may think, is this gluten related? I actually checked this with Vibrant America. I don't have any celiac markers. It's not related to gluten, because sometimes you can see that in gluten problems. This was the first time my testosterone was a little bit lower than what I was used to. So at this point, after seeing my thyroid function still so bad, after so long and trying so hard, I started on NP thyroid. So I'm now on 60 milligrams of NP thyroid. I take this on an empty stomach in the morning. And this is based off some convincing literature I've been reading, how we want to optimize our T3 to 4 to reduce cardiac mortality and improve lifespan. So I don't think it's healthy, even without symptoms, to live with a T3 of 2.7 as I was. So I'm going to start taking this just to prevent bad things from happening.
Dr.
Yes.
I think why you add is probiotics in your formula.
Megaspore.
Hotel, the probiotics, the pediform bacterium. So I told him I'm gonna.
Yes, I think he's familiar with that. I also did the micronutrient panel with Vibrant America. We can get this at Iron DPC. It's kind of expensive, about $400. But the benefit of this panel is that it looks at the white blood cell as well as the serum. So this selenium level is actually quite evident for why you would want to do this and forget testing serum levels. The reason my serum selenium is below the reference range here is because I forgot to take my selenium supplement in the week prior to this testing. Now, I had been taking selenium, as you had seen, for months now, almost a year. My white blood cell average is perfectly normal. But because I ran out of my supplement, I'm deficient. And so I think we should really stop testing serum values and look at more longitudinal sort of values like the white blood cell micronutrient. You can see here, I'm still low in my antioxidants. My cysteine level in the white blood cell is low. Obviously, it's higher in the serum because I take cysteine, I take NAC at night, 1,200 milligrams at the time, which I did increase after testing this, and I did start the Quicksilver Scientific glutathione again. All this, like this depletion of the antioxidants, it can be from several things, right? It can be from high oxidative stress in the body. It can also be from high intensity training, which I also do. An athlete like myself who trains intensely depletes their glutathione. So they have more amino acid requirement. They should supplement more. with cysteine and glycine, the precursors of glutathione. We just burn through it more. Males burn through it more as well, too. This was identified early in the pandemic during my initial research back in 2020. That was before FLCCC was around, and I was just working in urgent cares, and I called the CDC and I asked them, hey, we got this pandemic here. I got a guy, he's from England. I think he's got COVID. What should we give him? And they said, there's Tylenol, send him home. If he's bad, he has to go to the ER to get intubated. I was like, this is not good enough. So during my initial research to treat people, I came across glutathione. And lo and behold, men are depleted more in glutathione than women as well. So they need more glutathione, especially in the COVID illness. The COVID and all viruses in mold and mycotoxins will deplete the glutathione. And now I know it's not on Dr. Andrew Campbell's protocol to supplement with glutathione, but I think it's important to at least get the precursors in whenever you're dealing with high oxidative stress. Right? And of course, elderly have less glutathione than younger people as well, although I still have low glutathione.
Dr. Hartmann?
Yes.
Dr. Klatz here. Excellent information. You know, I applaud you. I'm curious as to approximately what you spent on the lab costs alone, because I agree with you entirely. I think we're doing it all wrong with lab. We're taking snapshots when we need to be looking over a period of months or even years to determine what our trajectory of our metabolism is. And I think that a new way of looking at lab is absolutely overdue. But how much did you invest in just the lab that you shared with us tonight?
What you're looking at right here is the white blood cell panel with Vibrant, and this costs $400 itself.
I understand that. I'm just saying.
Overall? Oh, man. Well, totally, I think it's $16,000 and counting. I still have to get my shower redone because there's mold in the grout. I hate grout. Never get a house with grout in it.
Okay. So about $16,000 over what period of time?
Over the past 2 years.
Wow. That's significant. And I think that it's money well spent. And I think that there's a better way of doing it. We need to put our collective minds together to come up with better profiles. Thank you very much.
Stefan, you spend that 16,000 for remediation or on your healthcare?
Remediation was 10,000. The ream light was 1,000. The shower install is going to be another 3,000 to 6,000. The labs, probably every lab, one of these functional labs runs about 300 to 400, and I've ran like 5 or 6 of them so far.
5 weeks ago after the
adds up.
Yes, it does. But I think it is mainly a remediation cost. So you may have to think that why did you have a mold to start with? You found that you have a mold, but now did you have any reason to think that why you have a mold there? Because the reason why I'm asking this question is that you don't want to see this happen again in some other part of the house.
Correct.
So it's very important that when you are getting rid of one, you also want to look at the whole picture.
Yeah, it's an old house. The AC somehow accumulated mold. There was dust in the mold. I think the vents weren't completely sealed. It's an old house. It's a thing we deal with in Florida all the time. I think half of my patient population deals with mold to some degree.
Stefan,
Yes.
and if you already presented this, that's my fault. Did you have some sort of a mycotoxin test or evidence of biofilms or some sort of antibodies to specific mold?
No, my only evidence was the mold picture that I showed you, and the green and the mold inspector who came and found it, and then by proxy, my depletion of the antioxidants, my high CRP, my elevated white blood cell count, when that really shouldn't have been happening for any other explanation.
Now, my question is, and I think this is extremely valuable information, are those markers, are those literally common for people with mold toxicity?
Yes. Well, not always. Some people, they don't respond with a white blood cell. Their immune system is so suppressed that they can't even mount an immune response to it.
So it's safe to say that your suboptimal thyroid function is also coming from the mold exposure?
Possibly. It's also a problem associated with low carb athletes. Low carb athletes, keto and carnivore, they'll suppress their thyroid function to very low levels. It's a problem associated with the diet. I wasn't purely low carb, like strictly, but I was low carb enough where I think it was suppressing my thyroid function. I've tried to fix that, but also I was not taking iodine. I've been iodine deficient for many years and competing at high levels of sports. Through my research here at Iron DPC, I've identified that athletes are the most iodine deficient population there is. We're all super deficient. So I think I burned through my thyroid through my high intensity sports and lack of iodine supplementation over many years.
Okay. And by the way, I didn't realize you were going through that. I know we talked about 5-amino-1-MQ for low intracellular NAD plus levels that are being suppressed by an elevated enzyme. But you had mentioned that that wasn't working. But I was just wanted to make sure that it was clear that I didn't realize that we were trying to treat something like this.
No, I was just
And,
trying out
right.
different things. So I wasn't necessarily, I saw that mitochondrial dysfunction on my Nutri-Eval, and I was like, well, maybe I can find some benefit with this. And it didn't do much for me, for my skin condition.
No, and I'm the same way. I tend to try this and try that, and almost like experimenting on myself, and then eventually I arrive at the truth. And so that's I mean, you unraveled a lot of things. The only thing I would add is, in what I'm familiar with, is the Array 12, the Cyrix lab.
We're getting to that.
Oh, okay.
Yeah, I didn't order it on myself, but I've ordered it on another patient, and we're going to see that. I want to do the Array 12. But this was that I had the nutrients, because I try to focus, doctors, I try to focus on the nutrients and the detoxification first before chasing after the virus. My theory is, and I think in functional medicine, we chase the viruses too much. We chase the mycotoxin too much. When we focus on the muscle-centric medicine approach, if we focus on the nutrient optimization approach better, the patient should be able to detoxify, should be able to not be completely debilitated by an Epstein-Barr virus or a mold. So we need to build up our reserves better, and we can be more resistant to toxins, which we really can't avoid.
So what
right.
I just
Okay.
Go ahead, Dr. Patel.
I think you're right, but if you look at our model of inflammation, because the inflammation model is that when you have excessive amount of total body burden, whether it is the toxins or whether there are a lot of from internal environment, external environment. In presence of nutrient deficiency, you develop inflammation. That inflammation can manifest either as a hypersensitivity or as a chronic degenerative disease, or a hypersensitivity, chronic degenerative disease, and a cancer and alike. So just by looking only at the nutritional evaluation and not paying attention to the reduction in the toxic load, body burden, you will not achieve the optimal response. Both things have to be done simultaneously. So, like you said that you did not do mycotoxin, you did not do immune panel, but you really, when you have excessive total body burden, and if your detox system is not able to handle, you will have a neuroimmune endocrine system amplification. And either you have a lot of neuro symptoms, you can have endocrine symptoms, and you can have a thyroid, you can have adrenal, you can have sex hormones, you can have a metabolic disturbances, you can have a immune system disturbances, which can be in the T cells, B cells, and immunotyping. You can have a vascular problem. So you don't isolate them, and you are probably, you have this much toxin, but you were not even as sick as some other patients because you were constantly exercising, although you were getting nutritional depletion, but you were also sweating quite a lot, and you were doing other things that probably saved you from the toxic damage to your brain and other, because you're, of course, you did have some endocrine issues, and you said you did have a rash, and what you had is a mold related illness, and they can affect all of these things. And the mycotoxin is important. You cannot say that you have a mold and mycotoxin illness because you have not proved that your body was full of mycotoxin. And even if you had done the urine mycotoxin level, and if your detox system was not working properly, you may not excrete at that point.
Correct.
And once you push your detox system, then you will all of a sudden, you will, when you repeat it in 3 months, you will have a heightened amount of mycotoxin. So everything what you have described just fits the picture, and I think what to go first depends upon what your practice is based on. But I think do both simultaneously, you have probably the best response.
Ideally, yes. And that's work sometimes with patients who don't have the budget to do that. So I have to kind of set my priorities. Do we test the nutritional deficiency? Do we test for mold? Typically, what I'll recommend is exactly what I did is I get a mold inspector. They spend the money on the mold inspector who identifies the mold in the house. If the mold is present in the house, as Dr. Andrew says, then the mold is present in the body as well. You can confirm it, of course, and we're going to get to confirmatory testing later, how to do this. But sometimes you do have to prioritize funds because, as you see, it gets expensive very quickly. This is my omega testing. Of course, part of Dr. Andrew Campbell's protocol is keeping high omega-3 index, which I was successful in doing. I do this also not just by supplementing and eating sardines, but I avoid seed oils as well. I avoid high omega-6 oils. Right? These are the cottonseed oils. You can see kind of the ratios here, 51,000, to 200 milligram omega-3 of omega-6 to 3 in cottonseed oil. You want to avoid also things like the soybean oils, grapeseed oils, safflower oils. High omega-6, you just mess up your ratio. You can supplement all the fish oil you want, but if you're taking so much omega-6, you're going to mess up your ratio. So just kind of be aware of that and avoiding these oxidized oils as well. But yeah, I had oddly low vitamins, and I was trying to kind of figure out why this might be. And one of my theories might be I was taking my supplements in the morning with coffee. Coffee, unfortunately, is a bit of a binder. Polyphenols and coffee itself and caffeine binds to vitamins, iron in particular. It's actually a treatment. If you have a patient with the hemochromatosis, you have them drink a coffee or a tea that's rich in polyphenols, and it will chelate to the iron. So that's something to think about. But vitamins are also produced in your gut. So that's something you also may want to test in patients. Do a gut protocol, which I actually just completed today. I got this in. I still need to look it over. I got this from Floor Clinical by Sun Genomics, kind of a new one I was playing around with. I still need to look at it a little bit more. My microbiomes has some work to do still to optimize this, to potentially produce my own vitamins and improve my detoxification. Interesting thing about this company is that they will compound a formulation for you. So that's what they're doing. They're sending me this Bifidobacterium lactobacillus streptococcus complex with some prebiotic in the mail to help fix my gut. So that kind of takes the thinking out of it for me, which I appreciate. So overall, my labs are better, right? My CRP, I don't know if we saw that. It did improve with the last panel. It normalized my oxidized LDL, normalized my all those things normalized. The adverse lipids normalized. So I was pretty happy about that, and my skin improved. So I think I'm successfully detoxing. So let's actually look, as Dr. Patel was suggesting, how to prove that you have a mycotoxin illness. Now, here at Iron DPC, we don't do urinary metabolite testing just for that reason that Dr. Patel mentioned. Is some people don't detox very well, and so it stays in their body. What we prefer to do is test the immune response to the mold mycotoxin, or in this case, and in this patient's case, Acinetobacter, which is a classically, you'll see this highly elevated in patients in water-damaged buildings. So this patient, he was suffering with the mold illness. He was using carnivore diet to control his symptoms successfully. Again, this patient, he suppressed his own thyroid function, so we also had to put him on thyroid medicine because carnivore does do that. You'll see that again and again if you work with this population. But yeah, he's so sensitive to mold. He'll move to the desert. He's that sensitive. So he was suffering again because Acinetobacter very high, making him sick. Here's another way you can test. You can do the MyMycoLabs testing. This is a patient. She's a 40-year-old female. She has had invasive endometriosis requiring hysterectomy, oophorectomy. She has chronic migraines. She's actively in a water-damaged building currently. We're trying to get this fixed for her. As you can see, she's elevated in multiple areas. And as Dr. Andrew Campbell and maybe Dr. Halasa know, the mold and mycotoxin contributes to the estrogen dominance, right? The mismatch between progesterone and estrogen. And then you get, of course, the estrogen proliferative disorders, endometriosis, right? So something to be aware of. Here's some more descriptions of these things. Again, toxin-producing molds are always present in water-damaged homes or workplaces. That's what Dr. Andrew Campbell says is true. So I don't necessarily always do this test for patients. It's fun to confirm, but again, this test is $400 as well. If they're also having a mold inspector, $400 come to the house, and then a remediation, $10,000, $15,000, $20,000. Man, this gets expensive. So gotta be aware of that. These are IgG and IgE antibodies, right? IgG antibodies to mycotoxins means current immune reaction to mycotoxins, okay? IgE antibodies to mycotoxins means stimulation of the mast cells with release of histamine, heparin, as well as inflammatory cytokines which cause inflammation. This can lead to mast cell activation syndrome. Okay, you can get all sorts of symptoms: gastrointestinal, neurological, as Dr. Patel mentioned, endocrine, cutaneous, as I had. You can get rashes on the skin, vascular problems. I was having all this arterial inflammation going on. This patient's white blood cell was not super elevated, right? As I said, some patients who have immune suppression from this, they may not even mount an immune response to it, but they'll still have the consequences of the mold and mycotoxin. So the white blood cell is not always useful. We did iodine testing on her, revealed some deficiency of the iodine. Recently, this is actually quite important to note. This patient is the first one I have ever treated with 50 milligrams of iodine for a UTI. So this requires further investigation and study. I now have an IRB approval at Iron DPC that can allow me to start doing maybe some studies for volunteers. But it's theoretically 50 milligrams of iodine, since it's eliminated through the urine, and iodine is antimicrobial. High-dose iodine may serve as a natural antimicrobial in an era of increasing antibiotic resistance, and where sometimes you'll see patients with multiple antibiotic-resistant strains in the urine. Having an option like 50 milligrams of iodine to treat this may be something we can use in the future in the era of antibiotic resistance. So at this time, she has resolved her UTI after a 10-day course of 50 milligrams Optimax for Escherichia coli, E. coli. Let's see. This was another interesting one. Dr. Halasa will be happy to hear this report. This is a 42-year-old female. She was in a water-damaged building. We know she had water-damaged buildings. She was trying to remediate. Eventually, she just moved out because she couldn't fix it. She felt fantastic with 20 milligrams methylene blue oral capsule. She said the brain fog improved. It's normally super frustrating. She's clear-headed, energetic. Again, methylene blue is a great antioxidant, buffers the redox. When you're suffering with mycotoxin, your inflammation is off the charts. So having this little medicine in our back pocket can help some people. This is a patient chronically with URI. After a month, she's getting sick, again, congested with headache, long-time exposure and water damage building. I once went into her house, I smelled it, and I could smell the mold. I literally could smell the mold in the house. She found a benefit with oral thymogen, right? That's the natural oral compound of thymosin alpha 1. Felt very good. Her sicknesses seem to have improved using this. So that's all I have for you guys tonight, and I'll take any questions and comments.
I just want to add something very important, and I think Dr. Hotel will support me in that. And there's an article for it, I just read it, that the probiotics, the clinical utility of probiotic therapy in managing mycotoxin illness. So I think probiotics secrete chemicals and enzymes that helps to degrade mycotoxins and bind, they act like binders and degrades the mycotoxins, plus it decreases the inflammation of the gut and the leaky gut syndrome. So having probiotic in the morning, whether, you know, there are less of them, but I think Betiform Bactrim is the top one that I would strongly recommend because they produce butyric acid in large quantities. But they can be secreting enzymes that breaks the mycotoxins, binders, and there's a very nice article about it. And we need to give a chance for Dr. Hotan. Are you there, Dr. Hotan? Dr. Hotan, are you there?
I'm here. Sorry.
Yeah, go ahead, introduce your, so then we can have questions for Dr. Stefan.
My name is Hutam Elamed, Dr. Halasa. I'm a pharmacist. We made our own line of custom probiotics. We have 2 new probiotics coming out, hopefully in the next 4 to 6 weeks, which will be mostly for anxiety and 1 for constipation. What we try to do is we mix probiotics, prebiotics, and then homeopathics and herbal that's related to that condition. So the first one we have available in our orange bottle is for weight loss and reduce your body's inflammation.
So I
Have you
just
guys
learned
have
from
any
this
questions?
article. I learned from this article that probiotics therapy can be helpful in mycotoxin illness. The article is very clear. It's a clinical utility of probiotics therapy in managing mycotoxins. So in addition to methylene blue, and as Dr. Stefan said, you know, all those glutathiones, you know, antifungal drugs are good. I know Dr. what's his name? Yeah, he likes to give antifungal, but antifungal also it does have some toxic effect.
Sporanox is pretty mild. That's why we chose it.
Wow. The less antifungal, I mean, if you have things that helps, like ozone and oxygen chamber and methylene blue and probiotics, and then you start with those things, and if it doesn't work, then you go ahead with antifungal. But I will not start with antifungal before I start with, you know, methylene blue. Put them in the red bed, and put light therapy, put ozone and oxygen. Give them probiotics because probiotics does have antifungal effect and good binders. Give them the detox binders, possibly the activated charcoal zeolite, things like that. And then at the end of the day, you can go ahead and say, you know, let's go ahead and give them antifungal if all of the previous procedures do not work.
Don't let Dr. Andrew Campbell hear you say that. He'll get mad.
I understand that because it's money-driven thing sometimes. But I think it's better to start with it. This is generally for all the protocols. We don't start with harsh things in the beginning.
Dr. Halasa, you use antifungal when there are active mold spores are present. But when there are no active mold spores in the environment and you are full of mycotoxin, you check whether your any sinus cavities or anything has living spores. That is the only time that you use the oral antifungals. Sometimes you just use also the nasal spray without taking oral antifungal. So there are different situations. You just don't treat every single patient who has a exposure for 3 years ago and has continued to be sick, has moved out, but is not better. That patient may not require a long course of antifungals.
Yeah, I agree. Just to start with more conservative, and then you move on to the next level. Like the same thing when we do in managing any chronic disease, we start with, first steps, and in the end, if inflammation is not being taken care of by all the things that we do, from the
So we are
polyphenols.
treating these patients for last 30 years, okay? So
Right.
I'm talking from my experience and not just treating patients hypothetically.
Right, I understand that. Yeah, I agree with you 100%.
I have a question for both Dr. Lass and Dr. Joseph. What about CLA as an antifungal, what Dr. Shingaris has? So I'm going to ask that to Dr. Joseph.
Make sure my microphone is on. Can you hear me?
Yes.
Okay, so my understanding is that the conjugated linoleic acid, especially if it is used or poured into a handheld nebulizer with a mask that goes over the nose and the mouth, so you're breathing in the mist, that it cuts through the mold biofilms. It cuts off, well, we know it cuts off fungal communication. I don't know if it's proven if it cuts off mold communication, but I get the impression that it does kill mold as well, and that is a great way to approach mold toxicity, since especially if there's evidence that there are biofilms, mold toxicity with biofilms, because most likely, at least my understanding is that those biofilms are usually going to be in the sinuses.
Yes. Have you ever used biocidin, like LSF, 2-3 drops in a neti pot and rinse it through the sinuses?
No, I haven't.
It's a great biofilm buster.
Amen.
Okay.
Dr. Lewis uses it all the time.
Yeah,
What is
extensively.
biocidin?
It's
by the
a
way?
herbal botanical solution that are antimicrobial and they bust the biofilms.
Okay, but is it killing the mold?
No, it destroys the biofilms is all. It doesn't kill the mold.
Okay.
No.
Well, okay. Well, I'm trying to kill the mold as well, but I'm glad you brought up this biocidin, because it's something that has come up in my learning. I just haven't had a chance to apply
it's
it
a
yet.
fantastic product. I have a case series on it. I'll give a presentation at some point. I've been using it now for 3 years. We have remarkable stories from that product.
Oh yeah, no doubt. This is even mentioned in, I think it's Neil Nathan's book, which is kind of like a really, one of the Bibles of mold treatments. So I understand that is that's high up there and well known in that mold community. I'm suggesting that conjugated linoleic acid, it sounds like that is something that could be a newer paradigm or a newer choice. And the reason is because if it does break up the biofilms and it kills the mold, that to me might make it even better than biocidin, and make biocidin more of a older type treatment. But whatever works, I'm not here to. This isn't a competition to see who's right here. But I have been trying the conjugated linoleic acid, breathing it in through the handheld nebulizer, and I'm going to be repeating my array 12. Okay. And the other thing I think it's important, again, and I understand the financial part. This is just the way that I've gone about it, and I like the way you've gone about it. You're coming at it from a different direction. But one thing I can say is not knowing which mold species you're dealing with might give you a disadvantage because different mold species produce different toxins. Now, the other thing is, now that we're dealing with a virus that's causing an epidemic of immunodeficiency, when we're dealing with patients who have chronic fatigue, which there's a lot of people. In fact, I wouldn't be surprised if most people have some level of chronic fatigue and they don't realize it because everybody else has slowed down. To me, it seems pretty obvious, but that's just my impression. But here's the thing: there's other pathogens that can be active at the same time. So when somebody is fatigued and we don't, can somebody
It's a
mute their
steroid shot.
Dr. Hutan, you gotta mute
can
yourself.
somebody can you mute yourself, please? Thank you.
I muted him.
Okay, so I've seen a lot of array 12s. I've seen a lot of immunodeficiency from the lymphocyte map. And I like to know who my enemy is. I don't like guessing. I don't like shooting in the dark. And I know that you're looking at the other patterns, and it's everything you're saying, Stefan, makes sense. I'm just telling you my aha moments with this stuff is that
test?
it's the same. I think it's the array 12, I think it might be less than the lymphocyte map, 350.
Oh, the
I don't
12.
know exactly.
The array 12 is cheap. I'm talking about the lymphocyte map.
The lymphocyte map, I think, is like 395 or something like that.
Oh,
400.
that's a great deal.
Yeah.
Hey,
So
Doc,
here's my point. I want to complete what I'm saying. You have herpes. I've seen herpes type 6. You see Epstein-Barr active. You can see cytomegalovirus. You could see whether or not you have the biofilms, right? You could see if you have multiple mold species, they produce different mycotoxins, and different binders bind different toxins. Not all binders bind every toxin. So like something like penicillium, that species can cause severe brain inflammation. I wouldn't be surprised if somebody had enough exposure and they had a predisposition, say for schizophrenia or bipolar. I wouldn't be surprised if those neurotoxins aren't strong enough to cause mental illness. Okay, and I think that's in the literature, but
yes,
I'm just I'm pretty sure, but I'd have to confirm. So, and then there's other species. That test is looking at about 30 other species, and so then you know what you're dealing with, and you're not having to guess. But mold is serious. It can be absolutely serious. Now you're healthy, and you did all the things. You're like me. I would have gone through a very similar process, and then I finally realized, well, okay, now I understand it better. Now I'll start with this thing first instead of wasting, going through everything I went through. But I think it's important to know the enemy, because those enemies are ultimately what's killing us. When you think about it, if our immune system is getting suppressed, okay, and I'm open when I say that, yeah, I'm very close to immune deficiency syndrome. That's AIDS. Literally. I mean, that was the scariest thing for how long people are so afraid of AIDS. Well, how many people are walking around right now who don't realize that they have AIDS? And what do people die of when they have AIDS?
Viruses.
Well, they die of opportunistic infections.
Fungus, yeah.
And then that toxic load gets so high, and I've heard Dr. Patel talk about this, that bucket gets filled up, And at some point, they will become so inflamed that they reach the point of no return. Okay, so that's why I am backing up this idea that, yeah, perhaps we really do need to look at this array 12 and lymphocyte map. Those are the first two tests I go to. Don't get me wrong, I like your approach too, but this is up for discussion. I think this is something we can go back and forth with. If anybody else has any comments.
The first test, you
Joseph,
probably get a CBC too, right? A first test that
Yeah.
would then prompt something.
Yes, you say that CBC, but along with that, and most of the insurances cover, you order the lymphocyte subset panel too, which is
Let me make something clear before we. Sorry, Dr. Patel. We might be in a position where we're not actually playing the role as the primary care physician. Now, I agree with you that yes, start off with the CBC and the CMP and all that stuff. I get it, but it may be that we are becoming or have to become sort of medical consultants, and that we are going to have our patients have their CBCs done by their primary, or if they've already had that done, which is usually the case, by the time they see me, they've already gone through this process and probably seen several other specialists at the same time. But it may be that we are becoming more of a consultant in that we're not set up with an insurance type system to check CBC, CMP. And also the question is, should we even try to become the primary care physician in this very dangerous atmosphere for medical doctors? So that's just something, that's the place where I come from when I say, yeah, I go for the lymphocyte map and the array 12 first. It's usually in the context that they've already seen their primary care doctor before they've even gotten to me. So I just wanted to make myself clear.
Hey, Dr. Joseph and Stefan and Dr. Patel. As a Marine, I'm NBC certified, nuclear, biological, and chemical contamination. And sometimes you just don't have a choice. The only thing left available is filtration. Straight up. And Stefan, have you, with some of your patients who can't afford all this remediation and all this testing and all this, crap, have you been able to figure out certain air filters that can filter out certain molds?
This one, it'd probably be the best. It'd be the whole house filtration system. You get it installed in your AC duct, and just skip the air doctors. They're just spitting out mold. That's all they do.
Kind of figured. Okay.
Yeah.
What's that run roughly?
This is a 1,000. You just get installed in your AC duct, and it zaps the dust that contains the mold. That's probably your best bet.
You also do another in-house filtration on top of that, just in case.
I talked to my mold inspector. He says he's tested these air doctor devices. They're full of mold every time. They're just spitting mold back right out. That's what they do.
Okay, and then what about the? Because I know our RVs use this. It's the moisture collecting devices that can collect moisture. You throw them out, collect moisture, throw them out. Have you ever used those?
Oh, you use your AC, right? You run the AC. You don't let it get too hot and humid.
Okay. Thank you.
Yeah, and Joel,
right?
Yeah, but Joel, I want to say something really quick, Joel. Yeah, here's the thing. Any patient that I see, regardless of their financial situation, it's about figuring out, okay, how do we make do with what we have? Okay, and yes, if they absolutely, of course, and I think that's a great way to come at it. Like, okay, if we cannot afford the testing right now, okay, and we're pretty sure that mold is the issue, and I like the idea of saying, okay, let's see if we can at least put in some sort of filters to alleviate that for now, and then it's just about coming up with the most sensible treatments. And Dr. Halasa has always said this: when you think about whether it's methylene blue, conjugated linoleic acid, especially, is super cheap. Methylene blue is very cheap. We do have a lot of modalities that are very affordable, very inexpensive, that we can use, and we can use our clinical suspicion to go ahead and treat. I mean, you know, who doesn't need a mycotoxin binder at this point, or some sort of generalized binder? I mean, we're like swimming in a dirty fishbowl at this point, right? So there's always a way, and so I just want to make sure that we're on the same page with that, Joel. That this isn't about being exclusive.
No, I understand. And
I just want to bring one more thing to the platform, that sometime patient will just present to you with no more complaint or nothing. All of a sudden they have become EMF sensitive. And EMF sensitive sometimes comes as a last straw on the camel's back. And you have to explore each layer, and you find that the beginning of the illness was the mold exposure. And then leading to all devastation in the immune system and the mitochondria, cell membrane, a voltage problem. So I'm just bringing this to attention, that have some questionnaires for EMF and have the patient fill out, so that you have a complete understanding about what's going on with your patient.
And
I think that makes sense, because they're all oxidative stress, you know, and they have synergistic effect there. You know, if you are being exposed to mold, then your redox is being compromised, then you become sensitive to any other source of oxidative stress agents. Let's say the EMF is the source of oxidative stress, and your body's being depleted from the fungus, so you don't have antioxidants to combat the fungus inflammation and oxidations, so it becomes sensitive. Yes, I think it's all those are oxidative agents, have synergistic effect, and they make the person sensitive. If you have fungus infection, you become sensitive to infection, you become sensitive to fungus, to EMF, electromagnetics, and you become sensitive because you're being depleted from the antioxidants power. So I think I agree with you. But again, you know, methylene blue, oxygen therapy, light therapy, those basic things, and then probiotics in the morning. I think it's a good thing, because those bacteria, as we see in this article, secretes constantly chemicals that breaks down the mycotoxins, and they are as well, they are binders. So adding probiotics in your regimen as a mycotoxin degrader and a binder is a good thing. So you start with those things, basic things, and weight loss program, because obesity and fat tissue, it's a source of oxidative stress. All of this, health optimization in general, empowering your immune system as part of your program, it will lead to help the condition of the patients complaining of. I just want to add something very important here, that next Monday, I'm going to be presenting cases generated by the AI of managing 6 hormones. In other words, managing or laying down all the 6 hormone therapy and protocols, the balanced 6 hormones. So I would like everybody who is attending today to be making sure Monday, because it's going to be a very big day, where we learn we are redefining the 6 hormone therapy. We're making sure that we are giving the patient enough progesterone, and we normalize the ratio between progesterone and estrogen in the state of what has been done before, which is just shooting in the dark, giving estrogen and testosterone without being balanced with progesterone, and making sure the ratios are being determined and known. So that's what we're going to have, many cases generated by AI. And if you have cases by your own, come bring them up, so we can come up with the right protocols that balance the 6 hormones. That's going to be on Monday. But I'd like to say thank you for the great presentation of Dr. Stefan today for mycotoxin detoxing. Do you think sauna will play a role in detoxing, or those mycotoxin is big proteins and it's not effective to do the sauna? What do you think about the sauna thing?
I'm
Stefan.
using it for my mercury toxicity, the niacin and sauna detox. I use it every day. I don't know if it works specifically for mold.
Yeah, because the mycotoxin.
Yeah, it does.
Does?
Yeah,
It does?
I've seen evidence for mycotoxins and heavy metals being sweated out. My
Okay.
question is, do we have to take a shower right away? Are we
Yeah,
at
I
risk
think
for
it's a
the,
good
for,
thing.
are we at risk that they are going to reabsorb?
I
Yeah.
think you're
So
supposed to, yeah,
what
yeah.
what I do?
I grew up in a Finlander home, and Finlanders, they're known for their saunas, and we used real saunas. We didn't use infrared. It's like Germany. These
Yeah,
were
we have the
hot,
same. We have a traditional.
Yeah, it was super hot. I was dying. My dad was like 180, 190.
190.
It was, yeah, crazy. But the amount of sweat that you sweat, we always washed it off immediately, and you felt so super awesome. It was absolutely easy.
Wash it off immediately. I also take a zeolite clay binder when I get in there sometimes.
Oh, okay. Yeah.
Let me go ahead and explain the sweating mechanism. Basically, the blood will filter everything like it's in the kidney. It will filter everything except the proteins, right? The big proteins and the red blood cells and blood cells into a tube, which is the sweat glands. And those tubes, they have transporters that will reabsorb all the good stuff back, right? And whatever it's not being absorbed is going to be getting out. So the question is that mycotoxins will be in a size that can be filtered to the sweat in the beginning. I don't know, how big is mycotoxins? Are they big to be not to be filtered? Like, is mycotoxin can be filtered to the kidney? That's the question. How big is the mycotoxin? Do you know, anybody knows the size of the mycotoxins? Are they proteins or they're peptides? I mean, peptides, I think it will be squeezed out, but I don't know about the proteins. So that's the questions that I'm. Well, Dr. Patel, do you have that answer?
Aren't the mold they found in the fat cells? So the patient who has more fat cells, the mold will hide there. It is more difficult to detox.
Well, yeah, that's the storage thing. But the question is that they filter it out? Things like in the kidneys, do we filter out? Do mycotoxin can be filtered inside the urine from the blood, or it has to be degraded first? So I just need to know whether that's the case or not. So that's my question.
Dr. Halasa, they're a single molecule.
Nope, we lost her.
You're muted, Dr. Dale. You're still muted. Bummer.
Man.
Ask to unmute. Let's do that.
Oh, yeah, I'm sorry, I couldn't get it to come up. Yeah, it's a single molecule. They're single molecules. They are filtered through the kidneys. That's why you can check the urine and find which mycotoxins you have. They form covalent bonds. So sometimes they're a double molecule, but they are very small.
Okay, that's a good answer. So I think then the sauna will be effective in getting rid of the mycotoxins.
Helping, but not by itself, obviously.
Well, not only that, if you think about it, with your photobiological, therapy and the red light therapy, what me and Stefan were talking about is hot rocks. These were hot rocks that were on a stove that you throw the water on, and you just cooked up these stove. It wasn't infrared saunas. It's two different type of saunas. So if you're taking methylene blue and you're doing the infrared, that's going to be a totally different health situation as compared to where you're just getting hot and you're sweating. So I have a feeling that a combination of the both probably would be beneficial.
Mm-hmm.
You know, Joel, actually, it's funny. Literally, I did one of those hot saunas here. It's in my building and with the rocks and everything. And yeah, I mean, it's crazy. I mean, I was afraid I was going to burn my toes if I, you know, put in, you know what I mean? I didn't know how to position myself because I was afraid I was going to get burned. But I was sweating like I've never sweat before, and I've done the infrared saunas. You know, when somebody is toxic in their mold, and they're mold toxic, and they've got multiple things going on, you know, you really have to just do, in my experience, everything.
Amen.
Anything, everything. You know, you have to be aggressive. And you know, I can tell that we've got a lot, a lot more to learn in this department. I mean, let's just get it out there. So I feel like we're just kind of stumbling over some of these concepts. We're getting there, but we're kind of behind. And I think we have to get caught up to speed because this is a much bigger problem now. What else was I going to say? Wow, I lost my thought. Hopefully it'll come back to me.
You need some methylene blue.
Exactly. But you know, I'm seeing it now. Oh, and then, you know, I talk about nutrition sometimes, or sometimes I say, look, I don't want to hear about nutrition right now. I want to learn about mechanisms of action. What I'm really trying to say is I want to learn how the nutrition is working, how it's targeting, why we're doing what. You know what I mean? And I am working right now with a book called Liver Rescue. And I found it's really good. And this other issue that we're dealing with, and I actually was talking to a naturopath, a well-known one who has people flying in from all over the place to see him. Does mostly Eastern medicine. And, you know, for them, it's common sense. It's like, yeah, the liver it gets congested like a car filter gets you know, dust built up on it. And, you know, when you think about how toxic we are, or as far as how toxic the environment is, and after, you know, so many years, imagine your liver is getting swollen. And in many ways, you could say it's getting plugged up, or there is the bile is getting backed up, or it's getting thick and sludgy. And at some point, it cannot really filter as much anymore. So imagine what happens then. The blood goes through. This was explained by this Dr. Campbell. Actually, he's a Dr. Campbell here in Florida. And the blood doesn't get filtered all the way. And not only is it then thicker, but it's dirtier. And that causes, he went through all the different organ systems. And you could see how reflux is one of the things that happens. As this sludgy, sort of thickened blood, after it goes from the heart, it goes to the stomach. And then if it's the stomach's not getting enough oxygen with this thickened blood, then you get things like reflux, and the valve doesn't close all the way. And the same thing happens with the intestines. I mentioned hemorrhoids. What about that? He said that's a direct evidence of this sort of thickened, backed up blood that's circulating through our system. And then it just keeps going on and going through, and then the liver gets bigger and bigger and bigger. Well, we have to, that's what a liver detox is. It's the process of sort of emptying out the junk that is in this sludgy bile that's blocking the ducts in the liver. It's making the liver not only unable to filter the blood like it should, but it also becomes a reservoir for pathogens. And because the immune system can't get to it. I guess you could see it that way. And so what if that's also a big piece of the puzzle that's happening? And if it's not being addressed, and there's chronic pathogens, there is the issues, systemic issues that come from blood that is, you know, that's not being filtered all the way. You perhaps have, this book talks about Epstein-Barr basically causing almost everything. If it just stays active, it moves into different organs. In fact, they talk about the Epstein-Barr being a big cause of hypothyroidism.
Nice.
And you could which I didn't even see that. I'm in my
Yes.
head thinking.
It's the push catch from
Quicksilver Scientific.
Quicksilver Scientific for the liver detox
Stuff's
that
amazing.
Stefan was just talking about.
Nice. So I'm gonna present after I finally get through this book. The basic gist of it, if there's a liver detox nutritional plan, is that every morning, sort of up until noon, you're sort of it's almost like it's a form of intermittent fasting, except for you are drinking lemon water, you are drinking celery juice that hopefully is juiced through, gone through a juicer, because I guess it works better if it's fresh. And then there's smoothies, and then you can eat apples. And basically, all of those, you can imagine that all of those fruit enzymes and very powerful antioxidants collectively, especially the celery juice, help to loosen that sludgy bile, and maybe even help the liver to kind of contract it and move it through the biliary system to get rid of it. It takes time, and from what I understand, this can take up to a year to clean out your liver.
And salt.
Okay,
It has something to do with salt too. It adds a lot of salts.
Exactly. So, look, I think it's about time that we start to get fluent in some of this language, and we can use our translational research skills to back up the science. Even if it's a few articles here, a few articles there, some of this stuff I understand is probably passed down by tradition. Or like you said, Joel, like Sana, like, yeah, I come from a Finnish family. This is common sense. This is what we do. It's 170, 180 degrees. They've been doing it for generations and generations. Why? Well, because it helps to clean the body out, and probably help to flush the liver or to move the blood. I'm sure, and I'll try to wrap this up here. My point is that I'm very interested in digging deeper into some of these naturopathic strategies, but then translating the literature and translating it into our language, because I'm at the point now where there's no doubt that we have to incorporate this stuff for ourselves. It doesn't make sense for us to treat other patients if we're not the example.
Yeah. Amen.
Right?
Mm-hmm.
And that's really my point.
I was going to say, it sounds like a juice fast in preparation for a gallbladder flush, or what you do for colonic therapy. And I wanted to mention to Joel that Sue Vogan, who's a doctor of natural medicine, she once told me that if you get some cheap vodka and spray it in your vent, that kills mold.
Yeah, true.
Brilliant.
Yeah, there's something to be said about, some of this old wisdom, or something that's passed down through generations. I just think, our job is to be the ones who actually put it in a scientific language. I mean, the only thing that always got frustrating for me was that I knew that you could get results if you juiced. Okay. My biggest thing, and this has a lot to do with my personality type, is I'm always asking why. Okay. And I feel a sense of, if you're going to run around with a medical degree, it's a good idea to be able to explain why this and why that. And so I'd like,
if I could piggyback on that real quick with you, Stefan. A lot of us are going back and forth between, vegan or vegetarian and carnivore. It's like absolutely huge right now. And I've enjoyed your presentations on carnivore, to say the least. but I don't see a whole lot of evidence of people who are fighting cancer eating carnivore. And I haven't heard Anthony Chaffee or Barry or Baker or Saladino talk about that. The people that I know per se, that I don't know personally, but the stuff that I've heard of that have fought cancer, they did it with plant-based medicine. So I'm kind of just, do you think that's partially media, or we've never thought
I think it comes down to calories really, and the main driver and mechanism is autophagy to beat cancer. So when you do a vegan diet, typically you do lower calorie,
right?
And that may be the main mechanism. And so you could do both, but the caloric reduction and putting yourself into fasting, I think, is the main driver of beating these cancers.
Got you, because you're not feeding anything.
You're not feeding it.
Yeah, and that's the way I like to come at this and think about it, is we have to put a context around these diets, because it does get confusing. It's like, okay, you're right. It might, okay, is carnivore the one? Is it the vegan? Is it the, I just had Dr. Campbell, he was saying, look, I have all these hardcore vegans, who they treat it like a religion, but they're anemic because they're missing critical components that you can only get from eating meat, apparently. And so what I'm thinking is, first of all, yeah, I think we do have different phenotypes. I think there's something to be said about, eating for your blood type. Some people are going to do better with more of a vegetarian diet. Some are going to do better with a carnivore oriented diet. But a lot of times when we put the context around these extreme diets are done because they have to eliminate something else. Like, for example, it might be that the carnivore diet is necessary, especially for people who are maybe unable to excrete oxalates. Yeah. I think that's what it is, that they're getting in some of the leafy vegetables. Yep. Or mold. Or mold. Yeah, yep. Exactly. So it doesn't necessarily mean that it's a forever diet. They're doing it with a specific purpose. Well, I like to know what those specific purposes are. Why are we doing this? Why are we doing that? Juicing. Why are we doing the juicing? Yeah, it's great. It worked. I can see. But why? And probably because it is providing those plant enzymes that help to break down the sludge that's causing our livers to become backed up, and also leading to the harboring of chronic infections, and maybe even parasites and heavy metals and these things, because I see these things a lot now because I take care of a lot of patients that are doing detox programs. And that's why it works. But then you don't stay on juices forever either. Even this liver rescue, it's extreme more at the beginning for the 9 days that you do it, but then you sort of ease off, and you can, there's something to be said about eating in moderation at the end of the day, or listening to your body. But I think we need to learn, and I'm going to do this, we're going to have to incorporate this language and take it seriously, because I'm convinced it's a no-brainer. How about that? It's a no-brainer that the other treatments we do are going to work much better if we are incorporating some of these naturopathic philosophies. And that's my message.
Okay, so Stefan, can you go ahead and you give us the kind of summary of what, especially the treatment for fungus infection?
The summary is you get out of the moldy building, or you remove the mold, you remediate. You do the basic protocol that we've discussed here at CDPM: iodine, selenium, B complex, the NAC, the glycine, the nitric oxide, vitamin D, omega, magnesium. You can do the medicines, the methylene blue, the sporanox. You do the sauna. You can do a binder as well in the sauna, like a zeolite clay. You can do like the push Klatz detox that Joel mentioned. Is fantastic for opening up those detox pathways. A prebiotic, a probiotic. The exercise, if we're talking about detox and opening up detox pathways, you have to talk about exercise. You want to stimulate the lymphatic drainage. How do you do this? High impact activities. You got to do interval training. You gotta move that circulation around. Okay, you can do the vibration plate training. You get on the vibration plate, you do the resistance bands. It improves the circulation, the lymphatic drainage. If you have access to it, you can do EWAT, exercise with oxygen therapy. You're breathing in 96% pure oxygen. You're gonna improve that nitric oxide once again. You're gonna kill viruses. You're gonna improve your immune system and circulation. So that would be the tenets of this protocol.
Great, great, great. I think that's kind of health optimization, but it's more directed into getting rid from the mycotoxins specifically. That's great. So,
Dr. Halasa, can I make a comment or two?
yeah, go ahead. Go ahead, Dr.
Hey, man, I was hoping you'd chime in.
Okay. Stefan, thank you for putting yourself out there like the goat on a stake. This is exactly what, and I think we've all talked about this board, and we have got to have a panel or a board that sits and talks and teaches each other. Because every time I'm on this conference or one of Dr. Lewis's, I learn 5 things, not one thing, 5 things that I hadn't thought about, or a point of view, looking at the same thing from a different perspective. So it's so important that we teach each other. To Dr. Joseph's comment, we're sort of going to have to be the referees here, at least for now. And there are so many wonderful things that are fun to do. What I do is, and again, we're building a center in Arkansas that is going to be a regenerative medicine and cellular medicine center. We've got the building donated. We've got all these folks that are coming. We need staff. So let's think about that. And Dr. Halasa and I were talking about having sort of an M&M conference, a morbidity mortality conference each week, which I think tonight was. And Stefan, you were nice enough to be the patient, the interesting case. The way we learn is by studying things we don't understand and being collegial like this group is, and not being tight-lipped in a conference room with their arms crossed, with surgeons over there, us over here, and playing that game. This is one of the most open-minded, educated groups of folks that I get a chance to talk to. It's a privilege. This project that we got going on in Arkansas is going to be one of many, and it can be done by this technique. And I recommend, and Dr. Halasa and I talked about it Thursday night, the case conference night, and have a patient come on. The way I used to do this, I had the patient come on stage and talk about what was going on with them. And then the whole group would sit and talk about, what am I missing here? What should we do? And to the point, this is expensive. But some of the things that we sort of do successfully, or at least early on in a patient's workup, these questionnaires are remarkably accurate. Just asking a person with traumatic brain injury or craniosacral junction issues, when they fill that form out, at the end of reading that, I know about as much as I'm going to know without an MR, without so forth and so on. And traumatic brain injury lends itself to that. These questionnaires that Dr. Lewis does for his lab work, he knows just about what the heck's going on without looking at those 55 or so items on the lab. So here's a very inexpensive way. And also it engages the patient day 1, minute 1, second 1. And when they walk in my office, I go, okay, what are we doing? And I go, well, my knee hurts. Okay. Let me ask you a question. How long do you want to live? And they go, what? Well, now we're going to get around to your knee here, but I see that pack of Marlboros in your pocket and you're about 30, 40 pounds overweight. I mean, what's our goal here? What are we going to do here? Because I got a bunch of patients, and if you're going to work to make you well, because I'm not God, we're not man-made. I can't fix you, but I can help you fix you if you're willing to do it. But again, you're going to choose. I'm going to present to you once we talk and work things up and so forth. Before we get into all the testing, where are we going today? And that's how it starts. And we learned this through the VA and asking those gentlemen that were wanting to just kill themselves because they were miserable for one reason or another. And what we noticed is if we could say, well, if you could do anything, what would you do? And for instance, one of them said, well, I've always wanted to climb this mountain, and I'm so and I'm capable of doing that now. And we go, okay, well, that's our goal. That's what we're going to work toward. I'm going to help you do that. And you're going to help yourself do that. And when we get done, you're going to pat yourself on the back because you're the one that's going to have done it. That is remarkably life-changing for folks when most of us go through life without ever having an injury. And Stefan, you're so young, you wouldn't know what I'm talking about. But as far as funguses and stuff like that go, we start getting these anchors dragging on us, and we're just going to fight through. So as a group, we have to treat ourselves. And if we have problems, not treat ourselves like offhanded on the phone, like friends, like patients. And Stefan presented himself today like a patient and was very, I must say, rational and non-self-serving in figuring out what the heck you thought was going on. Some of the thoughts were incorrect. How you work through that, that's how we learn, study our failures, absolutely. And as far as the inexpensive things we can do, very simple things in the very first meeting with a patient. What's our goal? What are we doing here? Fill these questionnaires out. Start getting some exercise. Try to quit smoking. Let's start eating differently, get better sleep. I mean, all these things cost us zero. And then we start looking at some generalized therapies. And I think what happened when Leeuwenhoek looked under the microscope and saw those little microbes moving around that drop of water, that's when the germ theory started. And now we got 62,000 CPT codes. We don't have 62,000 fixes. So the germ theory, interesting. The terrain theory, probably more reasonable. Let's, the metaphor is when I was taught in medical school, if a tree, if a human was a tree, he's got a sick limb, you got two options: chop it off or throw some chemicals on. In reality, figure out what's wrong with that limb and put it in the ground, in the soil, and it comes up to the root of the problem, the terrain theory. And so that we're all going to get the next COVID, everything's coming at us, live in this world full of fungi, which are going to outlive us, guys and girls. That's not even going to be a question. In fact, the fungus says, we're here to have a joint venture with someone, or we'll just absorb you. I mean, that was the punchline at the end of that movie, Fungi. But if we do simple things, hypochlorous acid, you can make that on your own. That's nature's own antimicrobial. It's safe for us. We can inhale it. This is great. Put it on your skin. Nitric oxide, you can get Nathan Bryan's supplement, dilate your blood flow, and then things like an endocalyx to make the gel lining in your capillary bed. Now, here's some things that are fairly inexpensive. So in terms of how does a patient fit into this, eventually we're going to have insurance products that pay for this, guys, because it's going to be outcome based. I don't care how much you spend, Hartsfield, get mama well. Okay, how much did it cost to do that? $20,000. She was headed for a $60,000 knee replacement. When? Everybody. And as far as your white cell count, Stefan, the problem with white blood cells, when we have chronically elevated white cells, they're very large and stiff. And little red cells are 8 microns, but they squeeze down to 5 microns to go through the capillaries, and they slow down like a little sponge, and they squeeze them at the good end. And then when they get to the bad end, they restore stuff and take it back to the heart pretty quickly. So white cells march right through it, and it scrapes off the endocalyx, the gel lining of the capillary. So chronically elevated white count will denude your capillaries. That's where 100% of the physiology goes. There's your bottom of the pyramid there. Endocalyx, dry seaweed. I mean, we are going to figure this out. And then if we could have a forum to present patients, they won't be as educated to have your point of view, Stefan, but they'll have an idea. If we can tease it out of them, they'll tell us what we need to know about it. And then we'll sit and talk as a group and go, whoa, so, hey, have you thought about this, selenium or something? I go, oh, thank you. And this could become a board of physicians and health providers that take difficult cases and solve them. And this is a vocation. And I'd like to propose at some point in time, maybe starting first of next year, to have a board, try to figure out how to fund people because it's going to take time and so forth, have a revenue stream for that, and start looking at people that have difficult problems. And almost the most difficult part is undoing the 19 drugs and that they're on. And how do we do that? And it's going to take a lot of us. Dr. Halasa is a wizard at this. I'm not. I'm an interventional radiologist. But at any rate, great group discussion. Stefan, thanks for following your sword for everybody tonight. Put some pressure on it. Bleeding is stop. All bleeding stops.
Yep. Yeah, fantastic. Yeah, maybe I'll come check out that facility. Sounds great.
I'm on it. I'm on it. It's mostly, I believe, for veterans and responders, correct?
Yep.
Hartsfield? Yeah, and football players, right?
Yeah, our goal is to be what St. Jude's is for kids.
Right.
To this group, first responders, NFL alumni, like the older guys with TBI and so forth, and PTSD, and then first responders. And regardless of ability to pay, we're going to take care of that group of folks. That'll be the base of the pyramid. And then we'll take care of regular folks that come in with diabetes and Walmart employees and stuff like that. Because we have a lot of self-insureds in Arkansas who want to do this. They're tired of being Blue Cross Blue Shield to do the highest cost treatment with all the consequences of drugs and surgery. Not that it's never indicated, but it should be way down the if-then chart, not the very first thing or two that we do.
I wanted to propose to Dr. Harshfield that he post this excellent idea on forum.worldhealth.net and get a lot of people interested. And I think it has great value internationally in many countries where people need to optimize the little that they have. So I think this is a superb idea.
It sure has worked for us because when I was at the medical school and when I was at the VA, I was the chairman of radiology here in Little Rock. It's the biggest VA of all of them. I had quadzillion dollars. I couldn't do what I wanted to. The bureaucracy said this is what had to be done. I had to leave the bureaucracy to do it. And most patients were not insured well. And that's when we kind of just figured out how to get started. And it's amazing that family comes on board and helps. And a lot of the so-called placebo effect, it's very powerful. And I think we're talking a little about the questionnaire and so forth. Your brain is the chemist of your body. And when you're happy, it makes a different kind of juice that your cells float in than when you're not. That's the beginning, just to see the look on their face. In a 50-cent glucose shot, posteriorly right here, 5 cc's on each side at the level of C6, buffered dextrose goes to the stellate ganglion. It changes their entire attitude. And that's the sorts of things that we're talking about doing. And then when they have really tricky problems, I mean, that's a different deal. But 80% of these folks, if we can just get them back up working, lose a little weight, give them hope and a narrative, they're on their way.
Well, Dr. Harshfield, I have something to add to what you just said about a board. So here in Nevada, we have what we call a homeopathic board. And this is a collective conglomeration of integrative practitioners. And this is actually covered and vouched for by the governor. So we are selected by the governor to be officers and actually select and police the practice of integrative medicine here in Nevada. So that's why when you mentioned about a board, this is actually state sanctioned. And as we set the standards for such, this can also be replicated by other states. And I think there's only Arizona and Connecticut who also has the same. That's why as we set the standards for this, hopefully other states, and with the help of all you doctors out there, can also replicate this and police integrative medicine properly in your own states.
Thank you. I'd like to volunteer. I have a Nevada license, as a matter of fact.
Well, you'll be surprised. We have practitioners who are from out of state as well, who are members of our board.
I'm working on a similar thing like this, that the reason why we choose chronic disease prevention management as the title, because American Medical Association, they are promoting it as a field of medicine needs to be integrated in the curriculum of medical school education and fellowship, residency, and continuing medical education. And I'm reaching out to the organization of AgeMed his name is Greg, and possibly they're gonna offer us one day complete lecture. I have the complete curriculum and structuring the whole thing. The problem with the integrated, regenerative, holistic, all that, and that's where the mainstream medicine, mainstream doctors are bugging on us. We don't have the structure. We don't have that, the complete protocol, the standard protocols, the references that can be replicated, because what's going on is like a wild horse and everybody's throwing its own things, and instead of having a complete educational program that include all the different directions that we are using, but in a more structured way and more synchronized way, in a way that it makes sense. So that's what I'm trying to develop with you guys, and it's in the process. We got Dr. Joseph, 4 clinics.
Dr. Halasa, Dr. Halasa, the VA hospital right now has something that's called Whole Health. And for the first time, they're actually introducing chiropractic care and acupuncture. And that's included in the Whole Health. So even the VA, I believe it's like, I don't know, 1,350 to 1,400 hospitals. Like Dr. Harsfeld said, they're the largest hospital in the world, technically. And they are introducing Whole Health. So they're easing into this whole process. But they don't want to call it integrative. They don't want to call it, functional medicine. They don't want to go down that path, but they kind of are. So it's kind of the political way that they're working with the AMA in a kind of a weird way. And I think this is going to be one of the biggest ways that we're going to integrate this whole process into helping millions.
Yeah, but the problem with that is that, when they just say chiropractic, they're using just pieces of the pie instead of the whole pie. I'm looking for creating the whole thing, which include all of this, so that we have a complete, include acupuncture, mainstream medicine, conventional therapy that's being combined with integrative medicine, a complete protocol that include everything, so that we have a complete solution for the patient, not pieces of it. Because once you get to the pieces, you're not giving a complete solution. You got my point there?
Yeah.
So that's what the chronic disease prevention management, and I already have the 15 modules, and I think I shared with you guys to look at it. And if there's anything missing, just let me know so we can add it. But those 15 modules is actually covering everything, including acupuncture. I think it includes everything. And if there's anything missing, let me know so we can add it. And that we have a complete, comprehensive solutions for the patients, and not just pieces, because those pieces may cover a little bit of the patient and take some layers of the onions, but it's not complete. And that's what we're looking for. We're looking for that complete solution, and complete education, and a complete fellowship, that when you come out of it, then you have really, you can solve problems of the patients. So the patients will come out in a good shape, and what we call the health optimization. Okay, great. So I think we're good today. Thank you very much, Dr. David, for coming and for contribution. Thank you, Dr. Joseph James Patel, Dr. Stefan, for your great presentation.
Thanks, Doc.
Hopefully
Thanks,
we'll
Stefan.
meet Thursday. I'm getting some doctors on Thursday for discussing this thing, which is the fellowship for doctors and membership for patients. So if you're interested, I will be inviting you so we can discuss that, because we want to create a memberships for patients that range from $100 per month to $100,000. So cover all the spectrum of the patients. I have something I created, and I think Shill is working on it. Dr. Joseph, Klatz, they're working on this membership. But I think in this membership of patients and fellowship of doctors, everybody can be part of it, and this membership can be an idea way that we can use it to optimize a patient's health, including everything that we are learning from those education program that we are entertaining. So something I'm gonna do it on Thursday. If you want interested, I'll invite you there. And then Monday we have a big lecture on optimizing sex hormones and all the protocols and rectifying that. So I wish everybody will come. So anything, if you have any questions, let me know. And Dr. Stefan is still here. So otherwise, you know, I'll say good night and see you next week if there's no questions.
All right, good night.
All right, good night, everybody. See you Monday, and for Thursday, some doctors will be invited so we can talk about membership and fellowship. Good night, everybody. Take care.
Good night.
Yeah, bye.